press the next
Ladies and gentlemen, it's my privilege to introduce one of the patients that we have treated in Innsbruck, Vasyly ROHOVYY, to you. I first met Vasyly in 2005 when he requested hand transplantation. He came from the Ukraine, and he managed to create a support group that allowed him to finance, potentially, hand transplantation, and he was visiting some centers, and that's when we met. And when he first came to the center, he didn't speak German, and we talked about hand transplantation a little bit and that it was a complex procedure, but I also said that, especially in his case, as he had lost both hands and also had a diminished visibility, which got worse after that, and he eventually ended up being blind, I said it's critical that we can communicate well. And in Austria, not everybody speaks English well, so I thought it would be important that he would speak German, and at that point he didn't. So he went back, and only a couple of weeks later he came to Innsbruck and he said, I want to do this, but he said it in German. And not just did he say this in German, but he had learned German over just the course of a couple of weeks. So I guess we figured out the chapter determination at that point. And that was only one of the many events that showed me who this person is. And I was frankly impressed by meeting ROHOVYY VASYLY and by getting the chance to treat this patient. He was eventually transplanted in 2006 and received a bilateral hand transplant. He was not the easy case in terms of post-op course and post-op follow-up, and maybe that's also the reason why we invited him to come here. He was not the home run where you put him on immunosuppression and you never see a rejection. Instead, he had 4 episodes of rejection and some mild episodes of skin rejection after that, and constantly we have to adjust the treatment. But also, he's a great example of a patient where you can do this, because he's so compliant that he would call you immediately when there's something happening and work with you and adjust the treatment over the phone or come in whenever you need him to. And he's also an example for a patient where we can do something for them and they might profit from the treatment that we have to offer, but in return, we profit a lot from the information that they give us. And for example, when Vasyly calls me saying that he has this burning sensation, and that we should rather maybe adjust the treatment, you better do so. Because I found out that he was always right every single time, that if we wouldn't, he would go on and we'd see skin rejection a couple of days later. So he would be the only person that I know of that could sense rejection before we can actually see it. And that also tells you something maybe about the mechanism and the things that we are missing by just looking at the skin. So that and many other things shows that we're dealing with a very impressive, unique individual, and it's my pleasure to introduce her patient, Vasyly ROHOVYY, to you.
Good morning, ladies and gentlemen. My name is Vasyly. I am from Ukraine. In February 2000, as a result of an explosion, I lost my best hand. Perhaps it was the most terrible day of my life. After the explosion, I didn't lose my consciousness, but couldn't understand what happened to me. I tried to rub my eyes, and only then everything became clear to me. I have no hands and can't see anymore. What happened later? 4 days in the hospital. That was all they could offer to me. My parents treated me at home as well as they could. Of course, it was a big tragedy for my family. The strong, healthy boy had suddenly become a disabled person, and I was in despair. No hands, the burned face, very poor eyesight. I didn't want to see anybody and stayed at home by myself, not knowing how to live future. A month after the explosion, my sister found, incidentally, a newspaper article about hand transplantation in French. Nobody wanted to believe that it is possible, but we started looking for a clinic that could help me. Of course, I didn't know then that it will take 5 years. And only in February 2005, we got the message from the University Clinic of Innsbruck that they can help me. When I knew about this, I jumped so high from happiness that I got my food. My sister and I came to Innsbruck, I passed all necessary medical checks up and was put on the waiting list. I met Professor Margreiter, director of the clinic, and Professor Schneeberger, who has been taking care of me since then, and other doctors who believed in me and gave me a chance at a new life. During the waiting time, we lived in Austria. It took 11 months. Of course, I prepared myself for the operation. I went on a diet, did sports, studied German, met two other hand transplanted patients, and certainly Professor Schneeberger told me about all consequences of taking immunosuppressants, including cancer and other diseases, about rejections and other risks. Before the hand transplantation, I wanted to improve my eyesight, but nothing came out of it. Of course, I knew about the risk of eye operation, but I believed in the best. After some operation, I lost completely my vision. In May 2006, my phone rang. I was waiting for this day for 63 months. But when it came, I was very afraid. I couldn't walk. My legs didn't work. After the surgery, I felt so bad that I couldn't think about anything except the pain. Frankly speaking, the happiness and joy that I have got my hands again came much later. The pain was so strong that I sometimes beat myself by the hand in sleep. I began to take painkiller. I couldn't believe that in such condition I had to do a therapy for the hands. I was thinking that is a mistake. I will die during the therapy. And only later I understood how it was important and did the exercises with pleasure. 4 physical therapists worked with me. It was difficult for all of us. We had many problems. The most difficult of them was my eyesight. I had to imagine, so to say, draw a picture in my head, how to move a finger, to imagine it, and only then to carry out a movement. For me, it was easy to imagine my finger, because I had strong phantom limb pain before and after surgery. I didn't always do everything correctly. It was a very long way, but I think we have succeeded. During the therapy, I had it for 3 years. I learned how to eat, to dress, to open the door again, and many other things. For example, I began to use the spoon without assistant for half a year after the surgery, the fork much later. I felt something in my hands for the first time for 2.5 months after the surgery. It was cold water. I was very happy. It was great. My hands can feel again. Unfortunately, I have had some rejections, but I was never afraid of them because I always trusted my doctors. Still at Ukraine, before the surgery, I decided to change my life. After the surgery, I began to study at the university. I stopped hiding from the people. I became more confident in the society, in my private relationships. I was very happy when I could shake with my father, with my friends, to take my girlfriends by her hand, to feel the human being's warmth. In my opinion, the hand transplantation can solve not only everyday's love problem, solve source problem, but also many psychological problems of the patients. That was the case with me. Unfortunately, I couldn't succeed in life without outside assistance and cannot support myself. My sister helps me. Without her help, I would never have got my hands back and wouldn't have a hope that I will once live a normal life with own hands and own eyes. I love my hands and wouldn't wish myself others. I have already forgotten how to live without hands. And now, when all pain has disappeared and all necessary operations on the hands have been done, I'm sure that the last step to reduce the medicine, we will succeed with this too. Thank you for your time.
Professor de Bernard first.
Yes, thank you very much for this
excellent presentation. I have a question. How long did it take for the sensitivity to get to the fingertips?
Wie lange es gedauert hat, bis du in den Fingerspitzen gespürt hast?
6 months?
Ich begann schon zu spüren etwas vor 3 Monaten ungefähr nach der Operation, aber es war Schmerz, nicht genaues Gefühl, etwas Bestimmtes, nur Schmerz. Aber ich konnte unterscheiden, dass ich das spüre.
So you started to feel about 3 months after the surgery, while at that point it was more pain than actual sensation. And so it was difficult to kind of differentiate when he started to feel rather than just feel pain as a response to the surgery.
No, because, you know, my question was very clear. I thought, I hope he was going to tell me 6 months or 9 months or something, or 1 year. But the question I wanted to ask, was there a difference before and after the sensitivity has returned to normal?
You mean before the amputation versus now? Wenn du vergleichst die Sensibilität vor dem Verlust der Hände, also mit deinen eigenen Händen, gegen das Empfinden jetzt, wie würdest du das beschreiben? Ist das ähnlich?
Es ist ganz anders. Trotzdem, ich kann spüren, dass es die Spitze oder jetzt ist Handfläche, aber das Gefühl ist ganz anders. Trotzdem kann ich unterscheiden, ja, wie früher, die Gegenstände, die Temperatur und andere Sachen.
So he says that he can feel right now, although it is entirely different to the type of sensation that he had prior to the amputation. So it is a sensation, and he can feel and do everything, but the subjective observation or subjective feeling of that is different to his own sensitivity that he had prior to the amputation. I mean, according to the measurements, to follow up with your question, sensitivity in his case came back rather late. Only after 3 years, his discriminative sensation was coming back, but actually coming back at the level we have not seen in any of the other patients.
No, what I just wanted to say, in our experience, where we have now 6 cases, when the sensitivity reached the fingertip, there was a lot of difference. When it, let's say that, for instance, when the sensitivity was at the middle of the hand, the patient was asking, "Doctor, how do you find the hand or the hands? How are they looking?" When the sensitivity was at the fingertip, they said, "How do you find my hand or my hand?" And I think that it made, at least in our cases, a lot of difference. The appropriation was starting, the real appropriation starting at the time sensitivity arrived at the fingertip. This means that in the cortex, in the cortical area, the hand representation is back to its normal place.
Okay. Dr. Pomahat?
Здравствуй, Василий, и спасибо. Я говорю по-русски немножко, но я понимаю очень хорошо. Мой вопрос будет по английскому языке. Thank you very much for coming, and it's very, very impressive. I strongly believe that the hands are actually the eyes for blind people, and it's even perhaps better indication for transplantation than in other bilateral amputees. One of the concerns that we have in patient that we're preparing for bilateral hand transplantation who is blind is the rehabilitation afterwards. And my question was, how did you optimize the protocol while you still cannot feel? How did you provide sensory feedback during the early rehabilitation? What kind of instruments did you use? What was the protocol?
We initially also used sensory re-education according to Perfetti in the other cases. When we did the transplant in Vasily, he was not entirely blind, but he had some visibility at that point. Only after some surgery to the eye was done, he lost his visibility altogether. So in the beginning, and maybe that was an advantage, he still had visual feedback. But again, there was an emphasis on sensory re-education according to Perfetti, with a strong emphasis on this, especially during the early stage, which is problematic in some patients because he asked them to think about what they feel, for quite a bit of period of time, and some patients find that exhausting.
Thank you. Please.
I'm Mary Jorosin from Rochester, Minnesota. I'm in physical medicine and rehabilitation. and very interested in the rehabilitation aspect of it, and was wondering if you could speak more about the details of the movement and sensory therapies, and whether there were any innovative activities or treatments or sports or alternative things that you found particularly helpful.
I guess you're asking the patient, and if I kind of summarize it, if there was anything in his rehab that was particularly helpful?
Or different also. Maybe he did things on his own outside of therapy that he found helpful that we might not have heard about.
Ob irgendetwas in der Therapie oder einfach in dem täglichen Alltag für das Wiedererlangen der Funktion hilfreich war. Irgendetwas, was du gemacht hast.
War es hilfreich? Während der Therapie?
Irgendeine Therapie oder eine sonstige Aktivität, wo du gesagt hast, das hat geholfen, um die Funktion zu verbessern.
Ja, es hat geholfen, weil wir haben das gelernt während der Therapie. Wie soll ich das zu Hause machen?
Nur die Therapie und die Anleitung oder andere Sachen aus dem Alltag?
Aus dem Alltag.
Zum Beispiel?
Zum Beispiel wie Hose anziehen, ja, wie so Klettverschluss, wir haben ja, die Jacke, ja, die Schuhe wie ohne Schnüren, ja.
So obviously therapy was helpful, but also other things of daily life, just putting on his pants, tying his shoes, things that he had to manage every day, he feels like helped to regain function.
He mentioned that he did some things with sports. Were there aspects of sports that made a difference for him?
Hast du Sport gemacht? War da irgendeine Form von Sport, die besonders geholfen hat?
Es war nur mein Wunsch. Ich habe das vor der Operation gemacht, noch in der Schule.
That was just because he enjoys doing sports, basically, and he felt like he would like to exercise after the transplant.
And then did he do any kind of alternative things like meditation or yoga or Tai Chi or something like that?
Irgendwelche meditative Aktivitäten wie Yoga, Tai Chi?
Thank you.
Yeah. Is that Christine in the back? Hi. Christine Novak from Chris?
I have a question regarding, you mentioned that you had phantom pain after the amputation. Did you continue to have that for a period of time after you had the transplant? And if you did, when did the phantom pain disappear?
Die Schmerzen nach der Transplantation, diese Phantomschmerzen, wie lange haben die angehalten?
Ich habe nicht bemerkt, wann sie verschwunden. Ungefähr nach einem Jahr, denke ich.
So he cannot tell exactly when it disappeared. It seemed that they got less and less, and as far as he can remember, entirely disappeared at 1 year after the surgery.
So would that have come at the same time as you got better sensation in your hand?
War das zugleich, wo du besser gespürt hast dann?
Nur, ich habe das, die Schmerzen sind ungefähr nach einem Jahr verschwunden.
Und gespürt hast du?
Gespürt, ich begann zu spüren nur früher, 100%.
Früher. Also he had sensitivity prior to the phantom pain disappearing, but maybe as we said previously, there was the pain getting less and the sensitivity getting better, and that seemed to have happened between early 3 months and 1 year after the surgery.
Thank you.
Stefan, I have a question. There is some anxiety about variation in function in proximal level forearm amputations. And I'd like to ask Vasily, after he had his initial period of healing, and let's say he was finished his pain issues, at what point, as he was rehabilitating, did he benefit from the hands even when they didn't have complete function? Did he perceive any benefit? Let's say he didn't get any motor function back, would he be able to do more, does he think? When did he believe that he was better with the hands than without?
Was für einen Zeitpunkt nach der Operation war die Funktion der Hände so gut, dass du gesagt hast, das ist jetzt eine Hilfe und ist ein Vorteil?
Meine Schwester hat mir früher geholfen beim Essen und als ich begann, ich habe schon gesagt, einen Gabel oder einen Löffel benutzen. Seitdem habe ich gesagt, Elena hat gesagt, eigentlich, du brauchst meine Hilfe nicht.
Und das war wann?
Und es war nach halbes Jahr.
Halbes Jahr. Okay.
Ungefähr.
So it was when he started using fork and knife, and that's also when his sister said, well, finally, you don't need me anymore. You can take care of yourself. And that's when he felt, this is actually of good use.
Okay, thank you. Dr. Sachs?
Hi, Justin Sachs, and the Anderson Cancer Center. I have a question. If unfortunately you were to lose your hand due to rejection, would you go through this process again?
Falls du die Hände verlieren würdest durch eine Abstoßung oder ein anderes Event, würdest du noch einmal eine Transplantation wollen?
Natürlich, ohne Hände, es ist unmöglich zu leben. Es ist diese Frage, das sind schon meine Hände, ja. Ich kann nicht sagen, ich kann nicht ohne sie schon leben.
He would say, of course, how can you live without hands? And these are my hands. If I lose them, then I want hands again.
Es wäre noch leichter, wenn ich das wüsste, ja. Dieses Weg.
Okay.
Wenn ich diesen Weg wüsste, wäre es noch leichter für mich. Jetzt weiß ich.
Okay, well, that's interesting. He said maybe it's even easier because now I know what I'm getting into.
Adam, please.
Adam Dawanasiewicz from Poland. Здравствуй. У меня есть вопрос. У вас уже возможно читать алфавитом Брайля? The question was if he can read with using the alphabet Braille.
Can you repeat it?
У вас возможно читать книги Брайлем, алфавитом Брайля? If you ob Sie mit Braille lesen?
Can you read Braille?
Ich habe das probiert, aber ich habe von dieser Idee abgesagt, ich will einfach das nicht.
Еще нет? Not yet.
Я не хочу.
Понятно. Спасибо. Всего хорошего желаю.
I don't want. Sorry.
Всего хорошего желаю.
Could you repeat his response?
So he has tried it and didn't like it, didn't think it was for him, and that's why he didn't continue to do that.
Okay. Other questions, please? Come forward. Okay, vielen Dank. Dankeschön.
Danke.
Stefan, what was next? Okay, Maria, would you introduce Ms. Connie Culp to us, please?